However, it's critical that players stay healthy if they hope to play in the postseason.
Yeah, the Sox, as you probably know, they've been plagued all season with injuries, but they're far from alone. Post-COVID, more players have been hurt this season than at any time in recent memory. We've got more this morning from Dr. Sebastian Ko, an orthopedic surgeon at Weiss Memorial Hospital, and, oh, by the way, former doctor with the Chicago Cubs. Good morning to you.
Good morning, Sylvia and Scott. It's a privilege to be on the show this morning.
Well, it's a privilege to have you, Doc. So tell us, why are so many players getting sidelined with injuries this year?
Yeah, I mean, with the pandemic-related restrictions, I think it's led to a giant off-season. You know, athletes are used to having an off-season and an on-season to compete, but with this giant off-season, I think from a physical standpoint, athletes are prone to injury, whether that's an acute injury or an overuse injury. And I think that's just because of lack of supervision during those restrictions. With athletes, if they have poor mechanics or technique, they may not know that, and they may propagate injuries because they're repetitively using those poor mechanics. So from a physical standpoint, I think players are definitely prone for injury. And from a mental standpoint, too, the team bonding experience is just not the same. And they're not match tough, so to speak. So I think from a mental toughness standpoint, I think athletes are prone to a mental injury, if you will, from episodic anxiety and depression as well.
Interesting. You know, okay, let's talk about just people in general, too. You know, obviously the couch potatoes and those who play in other games and sports that aren't the professionals, because there's all kinds of studies that talk about the benefits of stretching. You hear maybe you're not supposed to stretch before you run, and maybe you should stretch when you do this. So who should be stretching, and what exactly should you be stretching when you decide to do this?
I think everybody should be stretching. And I think, you know, we need to be optimizing our flexibility and strength before going back to competition. So I think a good way for people to think about it is think about the position that you're in most of the day, whether that's sitting or standing. Those joints get used to being in those positions prior to going into competition or to play. So I think stretching to get those joints used to being in the other direction as well, really make sure that the body's primed and ready to go.
You know, Doc, I'm sure I don't need to tell you that COVID really hit high school athletes particularly hard. They lost that opportunity to compete and bond, you know, with their fellow teammates. So a lot of them are back on the field for this fall. And maybe if they get hurt, they don't want to tell anybody because they don't want to be benched. If you're advising parents this morning, warning signs to be on the lookout for, maybe if their son or daughter isn't being straightforward, what would some of those be?
So I think some common symptoms to be aware of as a parent and as an athlete would be pain, stiffness, and instability, like the sense of a joint giving out. Common joints that suffer those symptoms are knees and shoulders. And so if I had to say 4 symptoms, it would be pain, stiffness, instability, and the sense of the joint giving out.
And is that when you should head to the doctor? Is that when you should take your child if they're talking about those things, or is it before you get to that point?
I think that's a good question. I think in terms of, you know, those symptoms and when they happen and when you should see a doctor, I think it depends on the setting. If it's an acute injury and there's a lot of swelling along with the pain, I think that's definitely reason to see a physician early. If the swelling's not too bad and otherwise function is pretty good, I think it's worth it to give it some time and see how it goes. But I think certainly if there's associated swelling and a lot of bruising, that's definitely a good reason to see a doctor.
Well, a lot of kids heading back to the field, to the gridiron especially. So Dr. Sebastian Ko, orthopedic surgeon at Weiss, thanks so much for
Thank you.
Yeah, good information this morning. Appreciate it.
Yeah, very good. I'm wondering if you and Mike, thank you for your time. I wonder if you and Mike stretch before you head to the refrigerator?
Well, no, I'm glad you mentioned the stretching because we did a study, a story about a study that said stretching was bad, and I was called